If you're planning on breastfeeding after your hospital birth, this video is for you. My name's Ashley, I'm a lactation consultant, and I'm here to help you understand all things breastfeeding. Welcome to my channel. What the hospital class is not going to tell you is how to breastfeed when things go wrong. What they are going to tell you, though, is how to follow their policies and procedures so that you're a good little patient. This is exactly why I do what I do, so that I can educate people prenatally so that they know what to expect before they even deliver. Ask your provider, whether that's your OB, your midwife, whoever that you're seeing, if the hospital that you're delivering at is going to have a pump. If they do have a pump, you don't need to take yours. If they don't, you do need to take your pump. You should probably order a pump between 32 and 36 weeks of pregnancy so that you have it just in case. Another thing about pumping is if you do have to extract milk for your baby after they're born, the pump probably isn't going to do a very good job the first couple days. People are so obsessed with pumping, and people are so obsessed with not pumping. So who do you believe? Which advice do you take? You only need to pump if your baby's being supplemented. Blanket definition. The breastfeeding class in the hospital probably didn't even talk about pumping. Maybe they mentioned to go ahead and order your pump. That might have been like how in depth that it went. But hand expressing, manual expression of milk is going to get the most colostrum out, because colostrum is so thick and sticky that it's hard for a pump to actually extract it. So your hands are the best tool. And hands in combination with like a hand pump or an electric pump or all three are going to get the most milk out. You might know what colostrum is already, but colostrum is the first milk that you've had since 12 to 14 weeks of pregnancy. It's the only milk you're going to have for about the first 2 or 3 days, and then your milk starts to transition from colostrum to transitional milk to mature milk. So it's basically just the early milk that's full of all the good stuff, very concentrated, very good for baby. There's people out there who say like, baby's more efficient than the pump. Not if you have like a 37-weeker. Those babies are sleepy. This is why one of my mentors in the hospital would, no matter what, if a baby was born at 38 weeks or before, would get the mom started pumping to just like jumpstart that production, because she knew that those babies were notoriously sleepy and would start them pumping just in case they weren't able to fully stimulate mom's milk supply. Now when it comes to like physiologically normal birth, nothing goes wrong, no interventions. Typically a baby is pretty good at stimulating mom's milk supply. But when you add interventions like fluids and baby's really sleepy and baby's born early, that's when you get the perfect storm of this baby might not transfer milk as efficiently as they could, and we need to give them a little bit of a boost by getting a head start on mom's milk production. So you hear people talk about the golden hour. The golden hour is like the first hour after birth where you want to get the first latch and everything's beautiful and baby does the breast crawl and it's just this beautiful experience. Okay, that doesn't happen usually. What happens is sometimes baby doesn't transition well to extrauterine life because of a difficult delivery, or maybe mom was high risk, or something happened and they needed to take baby away for, observation. So what do you do if you don't get the golden hour? What if you have a C-section and they won't let you hold the baby? Nobody talks about the first 4 hours. The first 4 hours are the most crucial time for mom's milk supply. The golden hour, we talk about it because baby's usually most awake, most alert, gets the best feeding. We get that bonding time, we boost the oxytocin, all these good things are happening. Then baby gets taken away, you don't get that. The first 4 hours is really the most important time frame for your milk supply. Starting hand expression, starting massage, starting pumping, everything that you can do to get those hormones flowing and remind your body, remind your brain that you had a baby and it's time to start producing milk, even though you can't put baby to the breast. That's going to be a really good way to get your milk supply off to a good start. Because when you really get down to it, the first 2 weeks is the most important when it comes to building supply. So the amount of breastfeeding that you're doing, the amount of good milk removal that you're doing, not just breastfeeding, the amount of times that you're removing milk, the efficiency of the milk removal, the amount of breastfeeding that you're doing in the first 2 to 3 weeks is going to be equivalent to how much milk you're going to have when your supply regulates at 3 months. I get babies all the time who their moms have come into the office and they're 2 weeks old and they're not back up to birth weight. And now we have to get mom started pumping so that she can supplement with breast milk instead of formula. And she can't pump enough because she didn't establish the supply in the beginning and she had no idea because she had no idea the baby wasn't transferring well. That's so heartbreaking to know that you can't feed your baby. So making sure that you try to do your best to establish that supply if you're awake and alert and able to remove milk. People do not tell you that if you have a C-section, your milk is going to take longer to transition from colostrum to mature milk. So, I get parents at like the week mark and they're like, I think I'm still pumping colostrum. I don't think that I'm getting mature milk. And sometimes that's the case. That's why it's so important to make sure that you are removing milk efficiently as possible for the first few days. But how do you know if you're removing milk efficiently? Especially if you're exclusively nursing. If you're exclusively nursing, you want to watch for wet and dirty diapers. You want to make sure your baby's gaining weight again after the 4th day of life. You want to make sure you hear lots of swallows, not just sucking while they're eating. If you're pumping, you should be pumping a couple ounces by the end of the 2nd week. But if you really want to get things moving along, don't just pump, don't just breastfeed. Add massage, use hands-on pumping, do hand expression between feeds. Stimulating your breast tissue as much as possible is what's going to really boost your supply. All right, so back to my original point, breastfeeding in the hospital. The first day, your baby's gonna be super, super sleepy. Regardless of whether they were born early or not, you guys have both just been through a whole lot. It's gonna be kind of a struggle to get 8 feeds in 24 hours, which is the goal. Then you transition to the 2nd day, and there's this thing called second night syndrome where babies really struggle the 2nd night because they realize they're separate from mom. They actually have to work to get their food. It's a whole thing. And you're going to get like 12 feeds in 24 hours. And maybe not. Maybe like 8 to 10, sometimes 12. It just depends on how hungry the baby is. And this is one of the most common times I feel like moms ask for formula because they think they're just not making enough. And really, this could be avoided if they just knew that this was a thing. And nurses know this is a thing because they work at night and they give formula. A lot of the times, these nurses might be trained in breastfeeding, but they're not lactation consultants. They don't really have a great understanding of like giving formula can sabotage breastfeeding. So we can't blame them for doing their job. But why does giving formula sabotage breastfeeding? Because formula always comes in like a 2-ounce bottle, and your baby needs like a teaspoon per feed in the early days. A tablespoon per feed, not a lot. So you shove a 2-ounce bottle down their throat, they're not going to eat for 4 hours because they're not hungry. Then they're not going to want to nurse, and then they miss a feeding, and then mom's milk supply goes down, and then we give more formula, and it's like this whole cycle. A lot of times, your hospital will have donor milk, and you sign a waiver, and you say, I'm okay with giving pasteurized donor milk, and you can get that instead of formula. Or what you can do is you can collect colostrum prior to delivery if you are low risk and your OB or your midwife or your lactation consultant think you're a good candidate. This is essentially hand expressing to collect colostrum, draw the colostrum up in a syringe, throw it in the freezer, take it to the hospital after you deliver so that you have it to supplement baby with if they have low blood sugar or if they're jaundiced or if they're sleepy. Lots of different situations where baby may need to be supplemented. But you don't have to give formula. And I get parents all the time who come in here too who are like, I don't want to give formula. Like I don't have anything against formula. I just don't want to give formula. And that's okay. That's your choice. I get parents in here who are like, if it doesn't work, then I'm just going to give formula. That's okay too. Like, just stop feeling like I'm judging you because I'm not. The other thing that hospital staff like to do is wrap your baby up in a little baby burrito instead of putting them skin to skin. Get them in a little baby burrito, then they can't breastfeed. Because what happens is they're so far away from the breast they can't even reach. If you unwrap the baby, put them skin to skin, put a little blanket over them, put them inside of your shirt, whatever you want to do, they're going to stay warm. It's going to regulate their body temperature. It's going to regulate their blood sugar. It's going to regulate you because you're close to your baby who you've been with for 9 months. And then you just continue that when you go home. Like for 2 weeks, just like I tell people just to walk naked around the house. Like shut your blinds. Doesn't matter. Like don't have visitors. Like just tell them to go away. And you just do skin to skin with your baby for 2 weeks. But, like if you have a toddler, I know it's a little bit harder, especially if that toddler just weaned like a few months ago, because then they're gonna want to nurse. Regulating yourself, regulating baby, that's really important for you, your milk supply, and your baby. Other things to know: if somebody does try to pressure you into giving formula, ask for the Academy of Breastfeeding Medicine protocol on that particular situation. They should try all the things before formula. Like jaundice, for example, they should try phototherapy before they try formula, which is like the light. I hope this video was helpful. Leave a comment with your thoughts and share this video with a friend. We'll see you next week.